Hi everyone. Today we are going to see about cholinergic system and cholinergic drugs. Let's discuss about these two chapters today. First, what is meant by cholinergic system? Actually, it is a neurons that synthesize, stores and releases the acetylcholine. The synthesize and stores and releases acetylcholine is referred as cholinergic system. And what is meant by acetylcholine? It is just a ester of choline that they are of neurotransmitter in the cholinergic system. The acetylcholine sites are of preganglionic fibers of sympathetic and parasympathetic areas. Let's go into the synthesis. First, it enters into the medulla. Medulla, it releases into acetylcholine is released and then enters into parasympathetic, sympathetic, sweat glands, skeletal muscle and somatic system. It starts in spinal cord and divides into further glands. It also enters into the blood vessels, adrenal and motor and skeletal muscles. These are the synthesis of cholinergic system. First we have seen what sites. First we will see the site called. The sites of cholinergic system are ganglia, sweat glands, skeletal muscle, adrenal, sweat gland, exocrine gland, lacrimal gland, bronchial and gastric acids. Then we go into the cholinesterase. What is meant by cholinesterase? It is an enzyme that divides the acetylcholine into choline and acetic acid. There are two types, true cholinesterase and pseudo cholinesterase. The true cholinesterase are found in neurons, ganglia and neuromuscular junctions and also found in red blood corpuscles and hydrolysis of acetylcholine. Pseudo cholinesterase is found in just in plasma, liver and glial cell. They doesn't get involved in hydrolysis. First we see about the actions of acetylcholine. It is a nerve terminal, enters in the action potential enters into the acetylcholine and acetylcholine is stored in vesicle forms in the presynaptic membrane. Then it gets released and it divides into two forms. One, it gets hydrolyzed into choline and acetic acid. The second one is enters into the cholinergic receptors, that is the postsynaptic membrane, into further branches. Next we go into the cholinergic receptors. First we have seen the cholinergic system, then we have seen the cholinesterase. The third one is cholinergic receptors. They are just divided into two types, muscarinic receptors and nicotinic receptors. They are both in common way, but we are going to see about what is the difference between the muscarinic receptors and nicotinic receptors. First we go into the muscarinic receptors. They are just a G protein coupled receptors, just divides into 5 types, M1, M2, M3, M4 and M5. It is also involved in regulation of intracellular second messengers. These are the types of muscarinic and nicotinic receptors. First we go into see into the 5 types of muscarinic receptors. M1, they are found in ganglia, gastric glands and central nervous system. The second one is in M2. It is also seen in heart, nerves and smooth muscles. The third one is M3. It is involved in glands and smooth muscles. Fourth one is in central nervous system and the fifth one is also in the central nervous system. Next one is nicotinic receptors. Cholinergic receptors are divided into two, muscarinic and cholinergic receptors. Let's go into the cholinergic receptors. Actually, the acetylcholine releases into the cholinergic receptors on the postsynaptic membrane and it gets opened. It's involved mainly in the action of opening the channel and depolarizing the membrane. Its main activation is opening the acetylcholine channels and depolarizes the membranes there. They are divided into two types, NN and NM. NN is divided into two, autonomic ganglia and adrenal medulla. It involved. NM is involved in neuromuscular junction. Let's see about the functional response of each muscarinic and nicotinic receptors. The M1 and M3 receptors is involved in the promoting the glandular secretion and smooth muscle contraction. M2 is involved in depressant effect on heart. The third one, nicotinic receptors, that is NN type, it involved in depolarization, and the fourth one is NM, it is involved in skeletal muscle contraction. Just we go into the recap as I explained. Muscarinic receptors is divided into 5, M1, M2, M3, M4 and M5, and the nicotinic receptors is involved in 2 types, just NN and NM. And we see about the characterization of both receptors. These are the cholinergic system. Actually, we have a recap of cholinergic system. First, we go into what is meant by cholinergic system, and we will see about the action, what is meant by acetylcholine and the sites of acetylcholine and the synthesis of acetylcholine. It is synthesis of acetylcholine is involved in sympathetic and parasympathetic ganglion, and is involved mainly in the medulla, that is in the spinal cord. Then we go into the cholinesterase. They are involved in 2 mechanisms, true cholinesterase and pseudo cholinesterase. The cholinesterase is involved in the hydrolysis of acetylcholine into cholinesterase acid. Then we go into the cholinergic receptors. They get divided into 2 types, muscarinic and nicotinic receptor. Muscarinic into 5, nicotinic into 2. Then we go into the cholinergic drugs. What is meant by cholinergic drugs? Cholinergic drugs, in that cholinergic drug, they are classified into many types. Let's see about the introduction about the cholinergic drugs. Classified into directly and indirectly acting one. It is given as intravenously to study the pharmacological actions about the system. They are also called as parasympathomimetics or cholinomimetics. Parasympathomimetics or cholinomimetics. Actually, the acetylcholine is a quaternary ammonium compound. It gets hydrolyzed by cholinesterase, as we seen before. Then we go into the classification. Cholinergic is divided into 2, directly and indirectly. Indirectly is also referred as anticholinesterase. Directly is divided into 2, cholinesters and alkaloids. The cholinesterase is divided into 3, acetylcholine, bethanechol, carbachol. Chol, we remember as chol. And alkaloids one is pilocarpine and muscarine, pine. The second one, indirectly acting, is divided into reversible and irreversible. Reversible into carbamates and irreversible into organophosphorus compounds. Let's go into the cholinesters. That is the first directly acting type. The cholinesterase is involved in 3 types, acetylcholine, carbonyl, bethanechol. Let's go into the acetylcholine. It is just a prototype of cholinergic drug. Cholinergic is also referred as parasympathomimetic drug. They produce actually the cholinergic receptors also has 2 receptors, muscarinic and nicotinic. So the same as acetylcholine has 2 muscarinic and nicotinic actions. In muscarinic actions, it is involved in cardiovascular system, smooth muscle, eye, exocrine, heart and blood vessel. Let's go into the first one, heart. In the heart, it decreases the sinus atrial node, that is SA node, and decreases the heart rate and also decreases AV conduction. 3 types are involved, 3 mechanisms are involved in decreases the SA node, decreases the heart rate and decreases AV conduction, and also decreases FOC. These actions are involved in heart. It is just similar to vagal stimulation. That is it. Then we go into the blood vessel. The cardiovascular system is involved into heart and blood vessel. First one is heart. It decreases the SA node, decreases the heart rate and also decreases AV conduction. Then the second one is blood vessel. It is involved in relaxing the vascular and dilating the blood vessels. It also involved in releasing of endothelium, depressing the relaxation factors and relaxing the vascular and smooth muscle. Three actions are involved in here. Releases endothelium, depressing the relaxation factor, relaxes vascular smooth muscle, vasodilation, and also it also involved in falling in blood pressure. The next one in muscarinic actions are smooth muscle. Let's go into the smooth muscle. Smooth muscle is involved in gastrointestinal tract. That is acetylcholine is involved into gastrointestinal tract. That is the M3 receptors, muscarinic M3 receptors. It increases the tone of non-vascular smooth muscle, increased in peristaltic movements, increased in GIT, and also involving in release of relaxing sphincter muscles. First four types are there: increasing the tone, increasing the peristaltic movements, increasing the GIT, and also relaxation of sphincter muscles. Then we go into the urinary bladder. In urinary bladder, it involves in contracting and contraction of detrusor muscle. It also acetylcholine contracts the detrusor muscle and also relaxation of trigone and sphincter muscle. Urinary bladder is involved in two actions. That is, one contracts the detrusor muscle and relaxation of trigone and sphincter muscle. The third one is bronchi. And also in the urinary bladder, it also promotes the voiding of urine. The third one is bronchi. It involved in contracting the smooth muscles and contraindicated in asthmatics, and also it results in bronchospasm. Secretory gland finally leads to dyspnea. First we see muscarinic action as cardiovascular system, smooth muscle, high exocrine, heart and blood vessel. Let's go into the third one, exocrine gland. The exocrine gland, it also stimulates salivary secretion, also increases lacrimal, sweat gland, bronchial secretions. The most enhanced secretion of exocrine gland results in dyspnea. Next we go into the eye movement. It also involved in constriction of pupil by contracting the circular muscle of iris. Mostly the stimulation results in miosis. Actually 1% of acetylcholine is used to produce miosis during the eye surgeries. Other than this, acetylcholine is not effective in much cases in eye if the drainage is facilitated and pressure fails. Next we go into the first we see in muscarinic action CVS heart and blood vessels, and the second one is smooth muscle. Smooth muscle is involved in GIT, urinary bladder and bronchi. The next one is exocrine gland. It involved in all our organs, salivary secretion, lacrimal, sweat, and also in dyspnea. The final one is eye movement is involved in constriction of muscles and also resulting in miosis. The next one is nicotinic action. In nicotinic action, it is divided in larger dose of acetylcholine is required. In nicotinic action, larger dose of acetylcholine is required. It resembles the same as alkaline nicotine. It involved in autonomic system. Autonomic system, it stimulates parasympathetic and sympathetic, like as a cholinergic system. Parasympathetic and sympathetic. The higher doses of acetylcholine causes tachycardia and also rise in blood pressure. It also stimulates adrenal medulla. Then we go into the skeletal system of nicotinic action. It had the acetylcholine at higher concentration. It also produces twitching, fasciculation, and depolarization. Contraction of skeletal muscles also involved in stimulating the receptors. Paralysis may also occur in these type of cases. Then next we go into the CNS type. What is a CNS type involved? Acetylcholine is a neurotransmitter, so it is get involved in several other areas of the central nervous system. It doesn't cause effect because of its poor penetration. It gets entered into the tissues, but it doesn't cause any other effects. Uses of acetylcholine. The use of acetylcholine is destroyed in gut when given orally. On IV administration, it gets rapidly metabolized into plasma. A not effective one. Only 1% that is due to meiosis. It is used in eye surgery. The other esters are carbachol, bethanachol. Carbachol and bethanachol. Bethanachol is also used as a selective muscle action, and also involved in GIT and urinary bladder. It has a longer duration of action, and muscarinic actions they have effect on GIT, smooth muscle and urinary bladder. They have non-nicotinic actions. It also stimulates peristaltic movements and also increases the tone. Then carbachol is involved in glaucoma and bethanacol is given into the hypotonia of bladder. In glaucoma cases, carbachol can be used, and also hypotonic conditions of bladder conditions is involved in it. Also drugs can be given as bethanacol, carbachol and bethanacol. And the third one and other esters are of methacholine. It is a rare one. It cannot be given. The adverse effects of acetylcholine are diarrhea, flushing, sweating, bradycardia, syncope and bronchospasm. Common symptoms like diarrhea first one and flushing, then the second one. Third one is sweating and decrease in the blood pressure, that is bradycardia, and the last one is syncope, and also it involved in bronchospasm. Next we go into the cholinomimetic alkalides, that is the second type of classification. First we go into esters of choline, that is acetylcholine, bethanacol and carbachol. The second one is cholinomimetic alkalides. The three drugs are involved in this: pilocarpine, muscarine and aricoline. Let's go into the pilocarpine. It is just like an acetylcholine. It also stimulates a cholinergic receptor. It is obtained from the pilocarpus plant. It is involved in increasing the sweat and salivary secretion. It is actually a tertiary ammonium compound, and it has two actions: nicotinic and muscarinic effects. They are used in xylogogues and xerostomia. In xylogogues, it is augmenting salivary secretion. In other conditions, in other areas of xylogogue, cevimeline and bethanacol can also be given in 30 mg thrice per day. And the second uses of pilocarpine is in Sjogren syndrome. Sjogren syndrome, actually what is meant by Sjogren syndrome? It is a dryness of all mucosal area, and the dosage of cholinomimetic alkalides can be given in, that is pilocarpine can be given as 5 mg thrice a day. In glaucoma condition, it is given as 0.5 to 4%. It also reverses pupillary dilation. These are the effects of pilocarpine. First one, it is obtained from the pilocarpus plant. It also increases the sweat and salivary secretion. It is used in xylogogue, Sjogren syndrome, glaucoma. It is a tertiary ammonium compound. The second one, adverse effects of pilocarpine are the salivation, sweating, bronchospasm and diarrhea. The second drug of cholinomimetic alkalides are muscarine. Muscarine is an active ingredient of mushroom Amanita muscaria. Aricoline just as obtained from arecanate. It also has two actions: muscarinic and nicotinic actions. The next one is anti-cholinesterase. Actually, first we see as choline, esters of choline, and cholinomimetic as a cholinesterase. The second one is indirectly acting one, anti-cholinesterase. It inhibits the enzymes of cholinesterase, so hydrolyzation doesn't occur. It also resembles as same as of acetylcholine. It contains anionic and esteric site. It is an indirectly acting one. Reversible and irreversible mechanism can be involved. They are of either carbamate or phosphorus compound. Let's see about the effect of esteric site and anionic site. First, acetylcholine is involved in. Acetylcholine doesn't get involved in anti-cholinesterase enzyme. It involved in an anionic site and esteric site. It gets bind reversibly in milliseconds, except the acetylcholine. And the second mechanism is about hydroponium. Hydroponium doesn't get involved. It binds reversible in a few minutes. And the third one is reversible anti-cholinesterase, doesn't get apart from the acetylcholine enzyme. It also binding reversibly in hours. The final one is organophosphorus compound. It either binds or now only bind to the esteric site. In the cholinesterase, we are going to see about reversible and irreversible. The first one is reversible. Its mechanisms are inhibits both the cholinesterase reversibly. The compounds involved are pizostigmine. It is an alkaloid obtained from the Pizostigma venenosum. It is a tertiary ammonium compound one and gets betterly penetrated through the tissues. They are also used in glaucoma and atropine poisoning. The second drug of reversible cholinesterase are neostigmine. It is a synthetic alkaloid one. Its actions are involved in neuromuscular junction, GIT, and also urinary bladder. It is same as of phyostigmine is a tertiary ammonium compound, and neostigmine is a quaternary ammonium compound. It has both direct and also an indirect effect. It doesn't cross blood-brain barrier. It has a poor effect in penetrating the tissues. These are the reversible cholinesterase. Then the third one is pyridostigmine. It is also same as of neostigmine, but it has a longer duration effect. It also can be provided in Myaesthenia gravis. The fourth drug is idroponium. It's a rapid and short duration used in common snake poisoning. Let's go into a comparison between the phyostigmine and neostigmine. The source of phyostigmine is a natural one. Tertiary ammonium compound. Neostigmine is a quaternary ammonium compound. Phyostigmine can be absorbed orally, but neostigmine doesn't get absorbed. Tissue penetration will be good in phyostigmine, but not in neostigmine. Blood-brain barrier can be crossed in CNS effect as in phyostigmine, but doesn't in neostigmine. Their uses are in glaucoma, and neostigmine uses is in Myaesthenia gravis. Poisoning effects are phyostigmine are used in atropine poisoning, and neostigmine uses are in curare and snake poisoning. Similarities mode of action, they are cholinesterase inhibitor. Neostigmine is a cholinesterase inhibitor. The uses of reversible cholinesterase are, they are used in high that is glaucoma, reverse pupillary dilation, and also in myotics. They are also used in Myaesthenia gravis, belladonna poisoning, curare poisoning, and urinary retention. The final one is Alzheimer's disease. Let's go by one. First, glaucoma. What is a glaucoma? It is a disease characterized by the intraocular pressure. If I find further, if it is rise in pressure, leads to damage the optic nerve, and also in severe complication, it finally leads to blindness. The risk factors of glaucoma are hypertension, family history, and also myopia. Finally, what is where the secretions are happened in glaucoma? That is, the aqueous humor secreted it involved in ciliary body and also drained through a trabecular membrane, so it gets involved in the further into eye. That is the common significance of glaucoma. Two types of glaucoma are involved, acute and chronic. The drug can be given for glaucoma are osmotic agents, beta blockers, prostaglandins, myotics, and also alpha-adrenergic agents. This is the glaucoma. These are the drugs that to be involved in the glaucoma conditions. First one, beta blockers, cholinergics, adrenergics, and alpha-2 adrenergics. The final one is carbonic anhydrates. In the first one, beta blockers, adverse effects are conjunctival irritation, redness, and discomfort. And the cholinergics, adverse effects are edema, spasm. Adrenergic agonist or adverse effects are redness, photosensitivity, allergic reactions. In alpha-2, conjunctival redness and photosensitive can be involved. And the final one is carbonic anhydrase. Adverse effects are hypokalemia, anorexia, and drowsiness. Then the second one is Myaesthenia gravis. It is just an autoimmune disorder that is produced against the receptors of neuromuscular junction. Signs and symptoms are just common weakness, fatigue, and these conditions are increased incidence in patients with thioma. First, to get confirmed with Myaesthenia gravis, a idroponium test will be done, and the Myaesthenia gravis and cholinergic gravis can also be seen there. Treatment of Myaesthenia gravis is glucocorticoids and immunosuppressants. These drugs are used in next one, phyostigmine for muscarinic actions. It is reverse central and peripheral effect of atropine poisoning. The next one is curare poisoning. Skeletal muscle paralysis can be occurred because of effective anti-acetylcholinesterase, and also neostigmine can be effective rather than the other drugs. Atropine blocks muscarinic side effects. Next one is urinary retention. In urinary retention, neostigmine can be involved in relaxing the tone and also relaxing the sphincter. Next, Alzheimer's disease. Rivastigmine and donepezil can be given. Not preferred. Tacrine doesn't be preferred because of its hepatotoxicity. Contraindications are asthma, peptic ulcer, and ischemic heart disease. The final one is irreversible cholinesterase. Irreversible cholinesterase is a organophosphorus poisoning. Toxicological importance will be main here. They are inhibitors of acetylcholine enzyme. They are similar to cholinergic system, but they are highly lipid soluble and can be observed mainly from the intact skin. Two types of irreversible, acute and chronic. The signs and symptoms of irreversible cholinesterase are muscarinic, nicotinic and central effects. Treatment will be atropine and oxygen can be given. Next, finally, we go into the dentistry related. In dentistry related, cholinergic agonists will be contraindicated because of an asthma condition, and also hypersalivation will be side effects of cholinergic agonist. First we see in the cholinergic system. Cholinergic system are get involved in acetylcholine, and we see in the nerves that transmits the impulse, that is a cholinergic system. And next one is cholinesterase. True and pseudo will be, and the cholinesterase divides the acetylcholine into choline and acetic acid. Then we go into the sites and sympathetic actions of cholinergic system. Next we go into the cholinergic receptors, that is muscarinic and nicotinic receptors will be there, and we go into the classification of cholinergic drugs, directly and indirectly acting. And then next we go into the ester choline. Esters of choline is involved in acetylcholine. In acetylcholine there will be actions of heart, blood vessels, smooth muscle, GIT, urinary tract and bronchi. Next we go into the cholinergic agonist, cholinomimetic alkaloids, and then the reversible cholinesterase, and finally into the irreversible cholinesterase. These are the short forms of cholinergic systems and cholinergic drugs. Thank you for watching this one.